Morning, everyone. Just a couple of quick reminders before passing the baton to our presenters today. If you have questions about the content that's being presented, please make sure that whenever you're sending that via the chat box, that at a minimum, you send that to all panelists. If you just send it to me as the host, I'm probably not going to give you as a robust response as our panelists will. So please remember to do that. And if you are having any difficulty technically in terms of sound or something like that, feel free to message me as the host. And with that, I will turn this over to Val.
All right, good morning. Oh, I'm going to turn my camera on, sorry. There we are. No, there we are. There we are. All right, good morning, everybody. Thank you for joining us today. We're up to almost 200 participants. We do have 9 panelists today. I was going to take this opportunity. I will announce right now, and if she's able to join, we will include her with some talking points. I don't think she's on yet. We'll check. Yep. Okay. So just a message to everybody. We have hired a new director of the Division of Developmental Disabilities, Jessica Bax, who is currently the Director of Senior and Disability Services for the Department of Health and Senior Services, will be moving to the director role on May 10th, and we'll be taking all of these opportunities between now and then to introduce her as she's available. She is still doing her other full-time job right now, so we understand that. So wanted to share that. Also in the back, you can't see him because he seems to be blending in today, but Director Stringer has joined us for part of our call today. So he's on the call as well. And another name that's not normally on our call, Dr. Stanislaus, is on our call as well. One of the things that we are going to be doing with today's call, actually the main purpose of today's call, and that's really what's on the screen right now in front of you, we're going to be addressing vaccine hesitancy among individuals, guardians, and staff members. We're going to show you some data around what we've seen. We're going to remind you of all the vaccination opportunities that are available. Remember, as of April 9th, vaccination is available to anybody in Missouri over the age of 16. 16 to 18-year-olds are limited to the Pfizer vaccine at this point, but it is open to everyone. So you don't have to prove that you're eligible for vaccine anymore. Your family members don't have to prove that they're eligible for vaccine. It is open. And we do have vaccine appointments across the state that are available. So it's easier to get access at this point when you're ready. Also, we're going to talk to a couple of providers, both state providers and private providers. Thank you, Julie Edlin, for joining, and April Maxwell and Susan Conaway from the state side. They're going to talk to us about how they've been able to get folks, both guardians, individuals and services, and staff accepting of the vaccination. And then at the end of the call, we're going to have Dr. Trivedi on. Dr. Trivedi is with Station MD. Station MD is he has joined us, I see. Station MD is going to be joining our calls for the next several set of calls to help address questions that folks have around the vaccination itself. So moving on then, let's go, Carrie. Let's start talking about some data.
So before we go on to the first slide, I just wanted to give everyone an update on our statewide data, and you can find this data on the covidvaccine.mo.gov webpage. There is a dashboard that has all the information about who has accessed vaccine as far as age groups, locations, et cetera. But we have crossed that 2 million mark in the state of Missouri. So over 2 million individuals have initiated vaccine in the state of Missouri, which represents 33% of our population. And of those who have initiated vaccine, we have 1.37 million who have completed vaccine in the state of Missouri. So we still have a long way to go to where we would like to be. And with that in mind, we wanted to see if we could get some data on our intellectual and developmental disability population in Missouri specifically. And so we were able to work with the Department of Health and Senior Services to do some matching between our data sets and their data sets. We don't know who any of these individuals are. We never had access to named data as far as who has received vaccine, but we were able to get some pretty good data as far as percentages of groups. And so what you can see on this slide here was looking at our population among the DD population in Missouri and the percentages of those who have initiated vaccine, those who have completed, and those who have not started. And then we were also to do a little bit of a breakdown into the age groups. So we were really looking at those 18 and over in that first line, middle column. that 44% of those 18 and older in this population have initiated vaccine. Yet when you look at the 16 and 17-year-olds, only 12.4% have initiated. And so we really have some work to do in making sure that folks fully understand that 16 and 17-year-olds are eligible for the Pfizer vaccine and how they can access that vaccine. Any comments on this one, Val?
Nope, move on.
So we were also able to have the work with DHSS and then look at it from some different views or perspectives. So we kind of assumed or thought that we would have higher rates of vaccine initiation and completion in our residential facilities within the community, and that does seem to be the case. You can see there in the residential column that we're at about 65% with initiated and almost 52% of those completed. Those that are receiving other community services or waiver services are about that 40% initiated and 28.8% completed at this time. So we still have a long way to go in that population. And then clearly we have a lot of work to do in our case management column, where we only have 29% of folks completed, or I'm sorry, initiated with almost 20% completed. And that is the group of people that really get the least amount of services from community providers and or interaction and contact with their state case managers.
Everybody needs to mute.
Yeah, if we could ask if everyone could please mute. We are getting a little bit of feedback. And then the last view that we were able to get looking at this is a breakdown by our regional offices. So all of the individuals who are receiving services through the Department of Mental Health are affiliated with a particular regional office who's overseeing that care and that coordination of services. And so we were able to do a breakdown by those regional offices as far as who has initiated or completed. And there are definitely some differences as you go across the state. Kansas City region, Central Missouri region, looking pretty good for the percentages of those who have initiated and then completed. So there's a couple of messages we want to hear from that as well. We really want to make sure that we are coming back around for that completed so that folks who got that first shot are getting those second shots, because that is what really brings you up to that full protection if you are getting those 2-dose vaccines. So definitely some work to do and some efforts to concentrate around the state. And I would also say that these trends that we see in these percentages by region, those are mirrored even in DMH's own population. So among our state staff and among folks in our facilities, we see those same kind of trends geographically that's reflected here in our community participants as well. So we're going to be brainstorming. We'll probably be reaching out to each of you as well on some ideas and strategies of how to get the information out and the messages and what are the particular barriers, the specific barriers for folks, as well as any ideas on how to target and what information or misinformation we need to overcome as far as vaccine hesitancy.
And another thing Carrie's been working on is she's going to start trying to make some contacts with some local public health agencies in these regions just to make them aware of this data that we have and see if we can figure out some other ways to partner. So look for that too.
So as far as vaccine opportunities, we wanted to make sure that everyone fully understands what is available and how to access vaccine. And I'm going to start with the retail pharmacies, because we will, as a state and really as a country, as this turns into a routine and a normal part of our life, these retail pharmacies are going to play a huge role in the access to vaccine. And so right now I wanted to point out on this slide, Hy-Vee and Walmart in particular. I have their websites up there. You do go to Hy-Vee.com or Walmart or SamsClub.com. These two pharmacy or the retail outlets in Missouri pretty much have vaccine at all of their stores. So with Hy-Vee, they're not necessarily in every store because some locations have multiple stores in one city, and they don't necessarily have vaccine at all of them. But these areas of the state where the Hy-Vees are located, I have verified they do have vaccine. Primarily, they're using Pfizer, so that means 16 and 17-year-olds can access it at these locations as well. Speaking from personal experience, I signed my own 16 and 18-year-old kids up to get it through Hy-Vee. It took about 10 or 15 minutes. I literally did it on my phone while sitting outside at a softball field on a Sunday morning. Got them signed up, had appointments for Monday, was able to go in without a hitch. There's no charge to the individual. They do ask for your insurance information because they may charge that administrative fee. If you don't have insurance, it doesn't matter. There's no barriers, there's no charge. For Walmart and Sam's Club, it works virtually the same way. Most of those locations are all authorized to be a vaccinator in Missouri. They may not all have vaccine on hand at the moment. I can tell you when I went in and played with their websites, it was also very easy. You clicked on the COVID vaccine, you will need to set up a user ID and password for an email, and then you can go through and select your store and select your time, and you schedule your appointment, and you just show up and get your vaccine. For Sam's Clubs, you are not required to be a member of the store in order to sign up and access vaccine at that location. There are other retail pharmacies available, including Health Mart. There's at least 21 Health Mart locations throughout Missouri that are vaccinators, many of them specifically in the St. Louis region. You also sign up online with them. Again, no charge to the individual. And then there's a lot of other additional pharmacies. So if you have a relationship or a partnership with a local pharmacy, you can ask them if they are a vaccinator and if they're participating and if you can sign up to get vaccinated. There are 875 different independent pharmacies that are participating, pharmacies and chains, that are participating through the federal partnership program. They are spread all throughout Missouri, and it does include CVS and Walgreens, Medicine Shop, Kroger or Gerbs, Good Neighbor. That's just some of the listings that are available. So you really should reach out to those local pharmacies if you still want vaccine or have new staff that are coming on that need vaccine. It's a quick and easy way to get folks access to that vaccine. Again, free of charge. If you don't want to do it through the retail pharmacies, there are still a number of mass vaccination events that are going on all around the state. So Vaccine Navigator is here on the screen, and we will make these slides available so people will have access to all of this. But you can go through that covidvaccine.mo.gov site, and you can see the events. If you sign up online to receive notices, then they will text or email you every time there is an event in your region, which is pretty big. Those regions are pretty big, so it won't always be an event that you're willing to go to. But in some instances, particularly for some of the mass events that are going on now, you can sign up and register, and then you will get a notice almost immediately where you can actually schedule your appointment. There's no charge to the individuals at any of these events. New events are added each week and each day, so if you don't sign up to receive those notices directly, you do need to check that site often. And some events that they're doing through these mass vaccination events are done daily or near daily. In particular, I will point out the Dome at America Center in St. Louis. They are doing daily vaccinations, literally daily, Sunday to Sunday, 8 to 6 p.m. for the next 6 weeks. This started on April 7th. They do have free parking at one of the parking lots. It's about a block away from the building, so they're also running a shuttle. The site is ADA accessible, and appointments and registrations are not required. You can make them. You can go through the Vaccine Navigator and set up your specific appointment so you have your time, but they're not required. Walk-ins are available. They are also doing it at the Capitol Mall in Jefferson City. They're probably doing it in some other places too, but these are the two that I know specifically. So they're doing it Monday through Thursday here in Jefferson City from 9 a.m. to 3 p.m. for at least the next 4 to 6 weeks. And you do need to register at this time through the Vaccine Navigator for those appointments, but they hope in the very near future to make those available on a walk-in basis as well. And then for folks also in the Central Missouri region, I know they're doing a big event at Columbia at Faroe Field, and they still had over 800 slots available for Saturday. So if you are wanting to go even as early as tomorrow, you can access it there in Columbia as well. And then finally, there are other healthcare providers where you have the ability to access your vaccine. So your local physician may be approved and may have vaccine on hand, or working with a specific medical group, or partnering with a local hospital system. So you can sign up through those physicians. However, you don't have to wait. You don't have to wait to get in with your provider or your doctor or until they're able to get vaccine. You can certainly access it through any of these other retail pharmacies or mass events that are going on. And in addition to federally qualified healthcare centers, 26 of them across Missouri have been approved as vaccinators, and they are receiving allotments of vaccine directly from our federal partners. So you can also access it through those sites as well. All right, and then that brings us to our first.
All right, so we are going to be doing some polling today. So the first question we have to ask is, and if you could please respond A, B, C, D, E, or F, for direct support staff that have not been vaccinated, what have you found to be the biggest barrier? And you guys can read that. Unable to find vaccine appointment, unable to get transportation, unable to fit vaccine into your schedule, person opposed to getting the vaccine, person wants to wait, or other reasons. So if you could reply to that right now and submit your answer, we will tally that up. Also, if you'll scroll up, there was something in the chat. Oh, can we see the chat? Yeah, go to the chat real quick. We're going to do that for a minute. So we did have a question. Are you requiring staff to get vaccinated? And is that how we can be in the same office without masks? So what we actually have in our department is we have something called a badge buddy. We do not require anybody to use a badge buddy, but if everybody in your meeting has a badge buddy, you can social distance. We're actually farther apart than you think we are probably on this camera. Then we do not require you to wear a mask in a small environment like this, although this is not that small. Like in our big conference room with our bigger meetings, we do still wear masks, but in this case, we know that Carrie and I both have badge buddies. We both know we're vaccinated. We're comfortable telling each other that, and that's why we do it. So, okay, let's check the poll because I think it might be done. Poll has ended. So can we see our results from the poll? So we had 166 folks didn't answer. 28 say persons want to wait to see what happens. 31 persons are just opposed to getting the vaccine. So it doesn't seem to be a lot of the, those seem to be the things that we're facing right now. All right, moving on. The next part of our presentation, we're going to, we have another poll question.
So for those who are opposed, what have you found to be their biggest concern? So individuals who are opposed to getting the vaccine, if you can click in your polling, it's now open, or it will be shortly. A, the vaccine was developed too quickly. B, the vaccine does not work. C, the vaccine is not safe. D, they've already had COVID, so they don't think they need the vaccine. E, it causes infertility, or they are worried about the side effects. So we only have a minute that we leave these polls open, and we strongly encourage any of you that are on the call and are connected through the computer to answer the poll. It'll really help us kind of get some feedback on some of these issues.
At least we push this feedback up. So when people say, why are people not getting it? We have plenty of vaccine appointments. Our answer back after this polling will be, it's not the appointments. We're still facing hesitance. It's all hesitancy, and it's either about wanting to wait and see or just don't think the vaccine is safe. And that'll drive our messaging. So this poll will close in about 10 more seconds, and then we'll look at those results. Again, thank you guys for taking the time to do this for us today. I love that one because I've had COVID and the vaccine. So while we're tallying the results, there is a question in the chat. There's a rumor that if you've had COVID, your side effects from the vaccine will be really bad. So I've had COVID and I've been vaccinated. My husband's had COVID, he's been vaccinated. My mother's had COVID, she's been vaccinated. My sister-in-law had COVID, she's been vaccinated. That's just my personal life right there. There's more, but I've had very few side effects. I had a sore arm. My husband was achy, some ibuprofen took care of it, 24 hours, he was better. My mom, she actually did have side effects for one day, and she went back and got the second shot because she said one day of side effects was substantially better than having COVID. And I know my sister-in-law felt the same way. So again, that's one of those, we just have to tell our personal stories, I think, on some of that to really get the point across. So again, 145 people did not answer, worried about the side effects from the vaccine, think the vaccine was developed too quickly. 17 people, the vaccine's not safe. And so there we go. So it's really about safety. Okay. So that's another great question. I've heard from some in the community that they can't afford the financial loss of the side effects from the vaccine following the vaccination. So what we do on the state side for our employees is we do allow up to 48 hours of administrative leave if you've got side effects from the vaccination. So that's available, and we try to plan around that. I know our schools around here, what they did was we did it on a Friday so that if any of the staff had side effects from the vaccination, those would be taken care of on Saturday and Sunday. So they're thinking about the best time for you to get the vaccination so that you won't have those financial losses. Those are some things that you can plan for, especially now that vaccine availability is going to be as broad as it is. So great questions. Thank you guys for the responses.
And one thing I would point out on that, and those are all very real concerns for folks, but by and large, individuals, and this has been my personal experience too, and we've had the whole household now vaccinated. It was a personal experience of all of them. Those side effects that most people are experiencing are maybe within the first 24 hours, and I would say well over the majority of them, if you take a Tylenol or an ibuprofen, myself included, it's perfectly fine after that. Within about an hour of taking that Tylenol, my achiness went away. So it's for at least what we're hearing and seeing, most people who do experience any of those side effects, it is really within that first 24 hours, and they've been completely resolved by taking some Tylenol or an ibuprofen. So that's definitely information to also continue sharing, because those are real concerns. Then we also wanted to share just that there are educational tools available that we can continue to push out and share with the community, with staff members, with individuals that are being served, with their family members, et cetera, as far as up-to-date information and facts about the COVID vaccine, as well as rumor control to combat that information. So you can also find this on that covidvaccine.mo.gov website. There's a section specifically, it's a question and answer section that provides you lots of factual information about the vaccines, as well as rumor control to address a lot of that misinformation that is being circulated in huge quantities on many social media sites. There's also a video put together by Dr. Thomas that really does a great job of explaining how the vaccines were developed and why we were able to develop them so quickly, as well as address some of those common myths about the vaccine. That is on the COVID vaccine website, but you can also get it directly to it on youtube.com. So we have the link there for that as well.
All right, so we won't do that one. Moving on, we will move over now to Julie Edlin. Julie Edlin's in the Kansas City area. She's a provider with Life Unlimited. She's had excellent, she's done a lot of good work getting her residents and her staff vaccinated. So Julie, please share with us your successes and your struggles. And I can't hear you, so unmute. I see your lips moving. Can't hear you.
All right, can you hear me?
Yes, ma'am.
Is my voice as slow as my face moving? I look like a robot.
Sound great.
Okay. Well, thank you everybody for letting me talk today. So we had 83% of our employees have received their second vaccination, 97% of our people in our ISL and group homes, and 75% in other programs. So they asked me to come and talk about what made it successful. And so I started thinking through that, and there were, it's easy now in hindsight to say what led us to this point. And there are a few different things I think that were pretty important. One, from the beginning of the pandemic, we had constant communication with all of our employees and our families. And we kept continual messaging going on that our number one goal throughout the pandemic was to keep the people we support and our employees as safe and healthy as possible. And we said that repeatedly. That's our number one goal. We went on lockdown kind of on March 16th and closed our day, employment, other programs, and residential at home. And we had some pretty strict rules. But when we went on lockdown, we had Zoom meetings for every employee every week, and all of our families and guardians. We had some people that said, well, maybe we shouldn't do that because employees may ask some crazy questions, and they did, and I said that's okay. They need to be able to say whatever they need to be able to say and be able to talk about, because it's a really scary year. And of course we, in March, none of us knew what we were doing. So I think that constant communication with your employees where you have an open environment was critically important. We built that so that when it came time to talk about vaccines, we had already been talking about all of the different issues that are going on with the pandemic. We also on our website had our COVID response plan, and that's live. So every meeting minutes, our whole plan, everything we've done, different professional videos about everything pandemic related and vaccine related, people could find on our website, and it's updated continuously. I think the first thing too is we had to know, did we have support and belief in the vaccine from our leadership? I mean, when the vaccines first came out, I asked myself, do I believe this is important? Do I want to get it? And of course, my answer was yes. But we started talking at every level of our organization about what people thought about it. And so when the vaccine first became available, we started having lots of meetings where we gave all the information we could about the vaccine. And then what we did is we organized the vaccine events ourselves. And so we conducted them on our property, and we actually organized all of the forms. So we knew then what employees weren't interested in getting the vaccine. So what we did then is we started making phone calls, and we had people that were close to them talk to them about their fears and why they were objectional to the vaccine. And then we went and found information that was relevant to their fears. So HR called people, our leadership called people. So it was very individualized, so that we made sure each and every employee that had a fear or was concerned that we addressed their concerns. You know, another issue is that we found early on that a lot of our employees who were persons of color or minority, they were at a higher percentage for not wanting the vaccine, and that's true in the whole overall community. So we made sure that our leadership that are persons of color, and that for every other thing that we address those issues and had conversations around that and talk that. And we also, Mayor Quentin Lucas, who is the mayor of Kansas City, came on one of our Zoom calls and talked about the fact that in Kansas City, people of color were less likely to get the vaccine and what that meant, because there are some real systemic issues and reasons why people are more fearful. And we need to be really open and honest about those and make sure that they're addressed by people that have a stronger understanding. So we found that those reasons really helped increase our overall vaccine numbers. Let's see. And then one of the things we did a few years ago, we had 3 individuals in one of our day programs that ended up on ventilators due to the flu. So we made the flu vaccine mandatory, and that was a 3-year process. So this year it was mandatory. Of course, now nobody has a flu, but making that mandatory and going through the exception process, our employees in our HR department really learned what that was about. And so we made the decision recently to make this mandatory. And we started with our executive team, and then with our management, and then administrative, and then for those of our staff that work in various homes. So in DSP, so we're progressively making it mandatory. Now we're worried about some legislation that may take that away. But our staff and employees, we've actually found, are more grateful and feel safer because we've created now, with that 83%, a safer environment. We did our own clinics, so we kept them very organized. We made sure that when people came in, they had their time slot, they got it done, it was easy. We also paid incentive for people that got their second shot. They were given a $500 bonus. They were also given a meal. We were really worried about the vaccines, the fact that we vaccinated hundreds of people on the same day, that we would all get sick the same day. And that didn't happen. We did have a few people with some side effects that couldn't come to work, but the majority of people were able to do some work. Or came to work. So I guess just kind of overall communication, talking to people individually that have fears, and really addressing people's concerns head on and being open and honest about it. One of my favorite stories is that when we first talked about making the vaccine mandatory, we had a very angry staff person make some comments towards me, and that I wouldn't get it, and da 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 da. And that was awesome because she was honest. And then when we did the vaccine, she called and wanted to know if I'd be there. And I said, yeah, let's go get the vaccine with me. And I held her hand and she cried. And I asked her about it, and she told me her real fears. And that to me was just acknowledging that she was really scared, and we talked through that. She went back to the day program, and 30 minutes later had her friend call me and ask if she could come over. Now she wanted to get it and if I would hold her hand. And to me, that was a really huge honor, but it just showed that our employees were really thinking through it and that we were listening to all of their concerns, because our employees have some real concerns. And also what we found is that our individuals, if the employees they worked with didn't want it, they didn't want it either. You know, there's kind of that, well, I don't want that. And you're talking about the fears, and that kind of bred over into what the individuals, our individuals wanted. Our residential, people in a residential program that are around us and had a lot of those conversations were more likely to get the vaccine. Where we are having an issue is people in maybe employment or community supports, those that we don't work with but a few hours a week that aren't hearing that message, they're less likely to get the vaccine than others are. So that's kind of what we found. All right. And that's that. Do I have any questions? I didn't see.
Not really yet, but you can monitor the chat, Julie. Thank you. Thank you for your insight. That was really good. You almost had Carrie and I crying. So nice job. I mean, that's real stuff. So I appreciate your time. Our next, we do have another audience poll question for, oh no, we don't, that's last, sorry. So next we're gonna move on to April Maxwell and Susan Conaway. They're gonna kind of talk about what we did at our state facilities to help get both our residents and our staff vaccinated. So Susan and April.
Okay. Go ahead, Susan.
I'm Susan Conaway. I'm the director at Northwest Community Services and the superintendent over at the Higginsville Hab Center. And our experience was very similar to Julie's. We did share the Dr. Thomas video with as many staff as possible and the town halls that were given by Dr. Stanislaus and Carrie. In the beginning, that really helped alleviate a lot of our staff who had fears about the vaccine. There was so much information out on social media. We were doing a lot of meetings over WebEx and that sort of thing with staff to try to stay off of those sites and let's listen to the facts and passing on that information that we were getting from these guys as well as just through DHSS. We also had people go talk to their PCPs because in most cases, PCPs were telling the individuals and the guardians that, yeah, they need to get the vaccine. In some cases, and we still talk to those, our vaccine rates for the individuals is very high in both locations and across the state, really. We're at 96%. So we just have a few individuals that did not get the vaccination yet. So we continue to have conversations with their guardians as well as with our staff who have decided to either they want to wait or they're just totally against the vaccine. We just keep going back and back and back and having those personal one-on-one conversations with people. And slowly, I think as more time passes, more and more people are willing to sign up. We did find out early on that it was a lot easier to arrange to have the vaccine come to us versus driving to like Clinton. That's where we went the first time. All 100 people showed up on the first day, and it was exciting because none of us had been out for a long, long time, but it was also very chaotic. And so we developed relationships with those vaccinators where they would come to us. Even small clinics, 20 shops, they would still come. So now we are actually working on at the Rehabilitation Center to actually be able to become a vaccinator so that we'll be able to vaccinate. We won't have to rely on outside vendors to come in. We can more easily vaccinate new hires that are coming on board, people that are changing their mind, as well as any new admissions that we take in the crisis programs. We have a lot of staff that are DSP in the DSP world that their peers highly respect what they have to say. And so rather than listening to me or listening to other support staff, supervisors, those are your staff who can help change other people's minds, including guardians, because they have close relationships with their coworkers as well as with the individuals and guardians. So if you can find out who those people are and make them your ambassadors, that will help get your rates up. We have benefited. We've had a long relationship with guardians because we've been around for a while, and the guardians respect what we are telling them, and we've been able to provide them with a lot of education around both the Pfizer and the Moderna. Those are the ones that we've had access to. And we've been able to talk through those issues with just about 100% of our guardians. And it's been beneficial that our staff have been educated because we want to make sure that if we're talking with the guardian, that our DSPs are having those same kinds of conversations and not getting conflicting information. Physicians in the community, for the most part have been pretty easy to work with. We've had a few physicians that have told staff, you know, wait, if you've already had COVID, wait. That was early on. I think the thought was you've got some protection built up, but save the vaccine for people who, you know, are at a higher risk. But that seems to be going away, and physicians are telling staff, and definitely with our individuals, that, yeah, you need to get the vaccine as soon as it's safe to do so. All of us who've been fully vaccinated, including the individuals that we support, we definitely have had more opportunities to return to normal, or whatever normal looks like. We're definitely not where we were a year ago, but it has given us a higher degree of reassurance that once you've become fully vaccinated, you do have protection that you didn't have a month ago or a month and a half ago. So it has helped people gain access back into their communities, being able to go to church again as those places start to reopen. We continue to wear masks at our sites. We encourage individuals when they go out to wear masks if it's safe for them to do so. We still follow all those guidelines. And what we found over the last year is everyone has been impacted one way or the other, whether it's in their own personal lives with their own family members, or definitely here at the workplace. Whether you've had the virus or you've worked with someone that's been exposed or that's been positive, it was a scary thing for everyone. And, you know, having to have PPE on 24 hours a day, and that was uncomfortable in the beginning for everyone, and including the individuals that, you know, couldn't even recognize their staff sometimes. I think as time went on and the vaccine was coming out, all of us were hesitant in the beginning, long before it was available to us. But after living through what we've lived through, most of us, including the guardians, were on board to be able to get the vaccine once it was available. And so being vaccinated has helped alleviate those fears, and knowing that we definitely have more protection than what we had 6 months ago. So, but really, just like Julie said, the key is just keep talking. You know, just sending out messages isn't enough. You've got to have those face-to-face conversations. Find those people that staff and individuals trust, and just keep talking.
I want to go back just to the 42% of our staff that are vaccinated, and that number is somewhat disappointing, but I'm hopeful. Like right now, I've got about 20 more staff around the state that are now excited and ready to get in line to get the vaccine, so we're getting them set up at some of the clinics that are going on. And it goes back to, you know, people are fearful, and I can relate to that. And as their friends, their coworkers, their parents, their neighbors get vaccinated and they watch them for a little bit, they become more comfortable with it. So I expect our 42% to go up. We don't mandate the vaccine, so they do have a choice. And anyway, on the 96% of the individuals that we have vaccinated, we've just had to be persistent. It hasn't been nearly as hard with those guardians because of the relationship that they have with the staff. And then we've got a couple photos. We just tried to make the clinics that we held at our facilities somewhat fun and motivating, so that when people went out, they talked about, you know, it wasn't as bad as I thought. And as you talk about administrators, you know, are they going to do it or not? Our administrators jumped in to go first. We've got one here who really went all out and was with every single employee that came through the clinics that they facilitated there. One administrator was scared herself. She typically, if she gets a shot, she has to lay down to get the shot. And so this was a really big deal for her. So her staff were kind of helping her by holding her hand as she did it, but she was first in line to take the vaccine. So that has been some of our strategies. And
thank you, Julie, April, and Susan. I appreciate you taking the time out of your day to help us kind of talk through what's working, what's not working. And again, The key is communication, and it's personal communication. I know Carrie and I were on a CDC call about vaccine hesitancy among direct support professionals, and it just kept coming back to communication. Some states are writing personal letters to staff. I mean, it just, you can't do that enough. And I know communication is exhausting, but you just got to keep at it because we have to meet people where they're at when they're there. We do have one more polling question. I think it's here. There it is, that we want to ask, and then we're going to move on to Dr. Trivedi, and he's seen some stuff pop up in the chat that he might want to address, plus he's got some experience. Dr. Trivedi is with Station MD. So let's go to this audience poll question first. For anyone who's receiving services from the division who's not been vaccinated, what are you hearing or what have you found to be the greatest barrier? So again, we go back to kind of some of those things we saw earlier. Can they find an appointment? Can they get transportation? Can they fit it into their schedule? Do we have enough staff so that we can take folks to get vaccinated? Do we have issues with parent or guardian approval? Or is it the person served that's supposed to get the vaccination? So that poll is running right now. You've got about 40 more seconds to reply to that poll. In the meantime, while we're doing that, Dr. Trivedi will be on next. He, like I said, he is part of our team at Station MD that have been helping us through the pandemic, and now hopefully after the pandemic is over, we will continue to utilize the Station MD telemedicine service. Station MD did a very large kind of Facebook Live event. I think it was a Facebook Live event that was recorded that talked specifically about the vaccination and also about questions that we're hearing from individuals and services when it comes to the vaccination. So poll closes in 3 seconds. And now it's closed. We'll get the results really quick. And while we're doing that, we'll go ahead and move this over to Dr. Trivedi. So.
Hi, thanks, Val. Can you guys hear me okay?
Yes.
Yep. Okay, great. So, I would just reiterate a few things. First of all, the conversation here has been fantastic. I can't emphasize enough the aspect of communication. We live in a world where there's so much information, misinformation, and people accessing it from all different corners. And so the more people hear what the facts are and understand personal stories, I think that the more the truth will get out there. I am a physician, been practicing for over 20 years in the emergency room. I'm based in the New York area. I still do practice shifts in the ER, but a few things that I just want to comment on and that you can bring back or for your own education. Unfortunately, COVID is still here and it is not gone. There's upticks, there's surges. You guys are all aware of this. So I can tell you from personal experience, I just go with the facts. I take care of people who get COVID. I've taken care of people who have died from COVID. Family members, this includes DSPs. These include individuals with disabilities. What's especially alarming that came out recently, about a few weeks ago, the New England Journal of Medicine came out with a study that said that outside of age, having an intellectual disability is the highest risk factor for contracting COVID and dying from COVID. That's disturbing. And anything we can do as a community to prevent that, I think it's incumbent upon us as advocates, as caregivers. I personally have been vaccinated. My wife has been vaccinated. She's pregnant. And so there's a lot of questions out there. The second thing I'll say is, as Val said, we're a resource for you. We are there to answer questions. Of course, we're there for any medical questions, fevers, falls, all those basic things. But if your staff has a question about quarantining or saying like so-and-so got COVID and should they get the vaccine, or can I come off quarantine or how long, call us. It's very simple. Our doctors are available for you 24/7. So if you have questions around COVID or anything about that, please don't hesitate to call. The other thing I want to kind of touch on real quickly is the safety profile of this. The vaccine, there was no corners cut in the development of this vaccine. It was done rapidly because the resources were there and people were willing to address it because it was a pandemic. But this vaccine has an extremely safe safety profile of the vaccine. Both of them, the Pfizer and the Moderna, is exceptional. You may have been hearing about some of the news about the J&J vaccine, which was pulled. Even that, in all fairness, the number of incidents that were negative are super low. I think 6 out of 6 million. So if that's a concern for people, I would let them know that this was developed following all protocols. And to date, changes rapidly. Over 80 million or so doses have been delivered with very few side effects. The other thing to answer questions, are about pregnancy and breastfeeding. As I mentioned, my wife is pregnant and got it. The chances of getting COVID in a pregnancy, the complications of that are higher, but this is really something that I would recommend you discuss with your own OBGYN regarding that. And the safety profile for those that are breastfeeding is also very good. But again, it's a personal decision. I never want to, this is not something that we mandate. This is something that you make a decision with your primary care doctor. I do also finally want to touch on the aspect of, hesitancy in terms of in this community. I think the more the word gets out, these personal stories are personal, but I think that's what's going to drive this. I got the vaccine. My parents got the vaccine. The side effects are extremely rare, and in the sense the ones that are there are arm soreness, a low grade fever. You feel like crap for a day. And I will tell you again, I cannot emphasize that you don't want COVID. It is a miserable illness, and you can die from it. I can't be more blunt than that. And I think the other aspect of this is that I want to emphasize is that you do it for yourself, do it for your family, but you do it for your community. The community that we serve is vulnerable. As I mentioned, that alarming study, we have to be proactive in protecting this population, and the vaccine will help you do that. And again, I can't emphasize enough, we're going to try to jump on these calls every 2 weeks, but we are there as a resource. If you have any questions about the vaccine, we're even happy to jump on and talk to a family member or DSP. My personal feeling is DSPs are essential workers. They should be considered essential workers and vaccinated like essential workers as physicians and nurses on the front line, because that's what they do. So I will stop there. And if anyone has any specific questions, I'm happy to answer those, even personal questions about the vaccine.
All right, thank you, Dr. Trivedi. And we're looking right now, I think you've covered everything that was in the chat already. There is a question in the chat right now on if we can elaborate on legislation mentioned regarding mandatory vaccines. What we're seeing in the legislative side, and I've not really been following this, so we will check in on this, was really more around the requirement or lack of requirement for a vaccine passport. So that's really what we're seeing, but that can morph. So we want to make sure that people understand that, especially in a legislative environment. So and
nothing has been passed.
Nothing. It's either gone from the Senate to the House, but nothing has been truly agreed to and finally passed or signed by the governor. So there is that. There is another question in the panel right now. I'll let you guys take a look at that. The other thing I was going to say really quick, while we're looking at questions in the chat, I think Jess is still on. Can you roll up to the panelists and see? So Jess Bax was able to join us. So I was going to let Jess take an opportunity, if she is still on, to introduce herself to everybody here. So Jessica, if you'd like to introduce yourself to the group.
Yeah, absolutely. Can you hear me okay? Okay, awesome. So it's wonderful to be here. And be with you guys. I jumped in just a little bit late, but my name is Jess Bax, and I'm currently serving as the Director for Senior and Disability Services, and I've been with the agency for about 16 years and had the opportunity to work with Val and so many of the DMH team members and community partners on all sorts of initiatives, including business acumen and value-based payment, and most recently, I don't want to call it an initiative, a response, a COVID response. We've all worked together on that, and I'm just really excited to be joining the team and learning from all of you and seeing how I can help. Throughout the 16 years here, I've done a lot of work in constituent services. Really, my passion is around helping families and individuals find the solution to their problem and then kind of expanding that to the wider system, and how can we make sure that that is no longer a barrier or a challenge for anyone in this and that's working in the system or needs services. So I've spent a lot of time in that. I worked in, was the policy chief for Medicaid long-term services and supports for our agency. We have 3 community waivers and state plan personal care, of which everyone who receives personal care in through a DD waiver also receives it first through the state plan personal care. So have a lot of interaction and partnership there in the past. And we also have operated the Adults Abuse, Neglect, and Financial Exploitation Hotline, which we do a lot of partnership there too. So really excited to come. We share a lot of the same issues, but I have a lot to learn. So we focus here on direct care workforce issues, value-based payment, and things of that nature. So from a personal perspective, I live with my husband and our 5 daughters in St. Elizabeth, Missouri. Our girls range in age from 17 to 20, or 17 to 2. So it's more like a circus than a family. And our oldest, she's the 17-year-old. She was born with intellectual and developmental disabilities, and she also has a lot of behavioral issues that she needs support with. And we actually went through a long, decade-long period of trying to determine a diagnosis, and only through advanced genetic testing did we discover a few years ago that she has a chromosome 14 disorder, but it's very rare. She's only one of 50 known people in the world to have this disorder, and so excited to bring that to the table and to see how the personal experience of working through the system, and not only through DD, but through children's division with her, through all of the medical and psychiatric stays, and the juvenile system and the court system. And we've kind of run the gamut and connected with other families. So I'm very excited to be here and start. I tell Val, I'm like, can I start today? But I am going to stay at Senior Disability Services through the end of this budget legislative session. So I'll start on May 10th.
Thank you, Jess. And it's going to make, I think for everybody watching or following along, it's going to feel like you've started, because you are really, thank you so much for taking the time to be a part of all these calls and all of these introductions. So I appreciate it. And I look forward to continuing to work with you and conquering the world together, right? Dr. Trivedi, I don't know if you saw the question in the chat about COVID and timing of when you have COVID and the vaccination. Can you see that?
I see. Should you get the vaccine if you have COVID? Is that what the question is?
No, I'll read it to you. Can you scroll one more, Gary? Oh, you see it? It says
vaccine.
Yep, you got it. Yep, that's it.
Yeah. So, the guidance on this changes rapidly, but this question was, I received the first of 2 vaccines on the 6th of February. I was diagnosed with COVID on the 15th and received BAM. BAM is the antibodies, the monoclonal antibodies. On the 16th, I was told not to get vaccinated again for 90 days. The short answer is this guidance is still in place as far as I know. This kind of stuff is still a moving target. I will add a few things that are recommendations based on the latest CDC guidance, is that you should always get the second dose after you get the first dose. If you can't make the second dose for whatever reason, there is some flexibility in the timing of that. It's not like you absolutely have to get it 28 days or 21 days. Even if you have to wait another month, you should get it. That being said, there's been a lot of preliminary data that shows even just the first shot, the first dose, does provide very good efficacy, up to 80% I've read. And the two together are over 90% for both Pfizer and Moderna. Regarding that not getting the second one, that's a specific issue that, again, that you really have to speak to your physician about after getting it. But outside of that, I have not heard of any other change in direction of waiting on that 90 days.
All right, thank you, Dr. Trivedi. And I think we're done with questions in the chat. So we will rejoin you all in 2 weeks. You know how I say we can't communicate enough, and Dr. Trivedi kind of got me back fired up on this again with his data-driven information about how, you know, individuals with developmental disabilities are going to be the second highest category of groups that are negatively affected by COVID. So everything that everybody on this call can do to help us push this message, anything you need from us to help push the message on vaccination, we'll keep getting the data and sharing it with you. We'll keep trying to find partners so that we can make it as easy as possible for everyone. But we cannot do enough right now, and the variants are here, and this is our best way to stay ahead of the variants. So please help us push this message, and let's keep fighting this fight. Thank you, everybody, for your time, and we will do this again in 2 weeks. Bye.
Thank you. Bye-bye.